Hey everybody, Dr. Maxwell here with Think Differently Thursday. We're glad to have Angela Human with us tonight. I say a new connection, but it's really an old connection. We kind of first reached out to each other back in 2015, and as you know, busy people, entrepreneurs, and life goes, we kind of found ourselves 5 years down the road. It was like, holy smokes, I didn't ever follow up again on our connections, and a lot happens in 5 years. And so that's really what we want to do with you guys tonight, is share that story of what happened in her journey with cancer. And I'll just tell you guys, we were kind of ahead of time, just not really scripting what we were going to say, but I wanted to just give her an idea of how it was going to go. So I'm just going to tell you guys, it's probably going to get a little raw. It may get a little emotional. But, and that's okay. Like, we want to just have both sides, and I want to hear more about, now that you've come out of it, what you're trying to do for patients. And so just real quick before I give her the floor, I want you guys, hey, Dr. Patrick Flynn's on tonight. So a couple weeks ago, I got the Alternative Medicine magazine out of Natural Grocers. And so what I really wanted to do is just continue to bring information to you guys about how the wellness way people and clinicians think, how we think differently about the Swiss Watch principle. So the last couple of weeks have just been looking at alternative medicine. And, we're often deemed as alternative therapies. And I made it very clear to our audience, we're not alternative. Like, we are a separate healthcare system altogether. Because I honestly don't really want to be accepted by the medical field, but I want to make sure I clearly communicate to them that we're not trying to do what they're doing in a natural way. That's what naturopaths and other natural functional medicine doctors do. And so we went through that, and I gave a couple different analogies. So with that, last week I talked about the healing power of the body and looking at the whole patient. And so when I read this, I was like, definitely bringing Angela on the show, because this was singing what you do. So I'll let you start now with kind of how you found out, what you went through, and we'll kind of go from there, you guys. So
sure.
hang on to your boots.
So thanks so much for having me. And I always sometimes I'm hesitant to tell my story, but every time that I do, I'm always just fascinated by people who you've touched in some way. And so I think today, whatever little bit of nugget, a bit of information that you can take and apply or think differently. I think it's really about awareness and my own journey. I can certainly share the story. So I was diagnosed with stage 2B. So I did breast cancer in my left breast and had 2 lymph nodes that were positive. And that was in September of 2018. So for an entire year, I went through 5 months of chemotherapy as treatment, and then 1 major surgery and then reconstruction. So for an entire year, my body, talk about the healing process and recovering, went through a lot. It's a lot of stress, and not only is the cancer treatment just stressful enough on somebody's body, but then we all have things, right? We have kids, we've got head of household, we have businesses, we have all of these things and obligations that none of them stop. No, just because you were diagnosed with cancer, right? So it is a lot of just simply keeping up with, what is the biggest thing that I have to do this week? So one of the things that I was really happy that I did is I took and it really started out by really just paying attention and being intuitive. So when I say intuitive, I had started meditating because I'm an avid podcast listener. And I kept listening to Tim Ferriss, and all these really successful people. And they had all one thing in common. They all were doing meditation. Okay. Really centered, taking time out, just 10 minutes. And I'm telling you what, it was one of the hardest things that I've ever done, but one of the most important things. So I had that definitely going for me when I showed up with a cancer diagnosis, showing up ready, being semi-ready for something like that. And I think it was really important because if you're not in touch with exactly 100% of what your body is telling you, right? It has the ability to heal itself, But if you're not listening and you're in automotive, like just getting up every day and doing your thing like we all do, right? You're not paying attention to the signs. And I think it's so important. Like, even it's the one nugget today that you take from this of just simply stopping, being present in the moment, and being aware of what you're eating, what you're drinking, what you're consuming, what information, if you're listening to the news and putting fear-based things into your mind. All of these things make a huge impact, I'm telling you.
Yeah.
So I had shown up with a cancer diagnosis, maybe a little bit ahead of the game. We had talked a little bit too about what we have a perception, I think, physically of what people are as well. Oh, she's healthy. I thought I was healthy. I'd been to the gym. I go probably 5 or 6 days a week. I eat healthy. I thought I was doing all of these things, but it really wasn't until after my diagnosis and after getting through my treatment that my main motive in December of this year in 2019 was, okay, I am through cancer. I'm done with all of my treatment. Thank goodness I am cancer free. At this point, moving forward, my goal is, how do I stay cancer free? Because for me, what didn't make sense, if I go back to my same exact life, and I keep doing the same thing, like eating the same healthy things and going to the gym and doing the same workouts and not change anything, how in the world do I think logically that I'm not going to get cancer again?
Right.
Like, it just did not make sense to me.
We talk about that in our inflammation talk, where, I asked what are the 3 main components to health, and the people say the same thing every time: sleep, exercise, and eating. I'm like, all right, well, here you have it, guys.
I know.
She ate mostly organic and was mindful of what you ate, exercised on a regular basis, and practiced getting good sleep. So I'm going to throw maybe a little meditation in there, maybe not as much until after getting the cancer. But I want you guys to understand, just because you do those things doesn't mean it produces the actual functional well-being that you need in your body. That's like, I thought I was healthy until I got tested and found out 31 food allergies and low testosterone. And recently I'll go over my immune panel and just some surprising things on that. And so, being able to have you come on and share, again, the perceptions as people are outside looking in, well, oh my gosh, like if she's doing that and gets cancer,
right?
People are just like, forget it. Like, why should I even try? She's trying to do the right thing. And, so why should I, if I'm overweight and I'm kind of, I cheat here and there, I eat a little too much sugar. So it's like, what can we do tonight to try to get them to just change some things a little bit?
Well,
I think.
I'm a huge advocate for when you know more, you do better, right? And so for me, I didn't know any better, right? I thought I was eating the right things and doing all of these things. But even with a cancer diagnosis, we all know that there are people who live in survivorship for a really long time. And there are people who have chronic disease that are living with COPD, and they're living with all of these chronic diseases for a really long time. For me, I had just learned how to rock climb. And I was like, neuropathy, where you lose your feeling in your fingers. And I was like, oh, hell no.
Yeah,
so it is quality of life for me.
Yep.
And I would think that a lot of you watching, or people in general, it is a quality of life. So we had talked to you about the spigot.
Yep.
And chronic disease like this, it's the little drip, and then before you know it, you get to the point where it's really difficult for the body to go back and redo all of those things. So at the age of 49, soon to be, because I'm coming up celebrating a birthday here pretty soon by myself. But
thank you, social distancing.
I know. But anyway, so, it's important to know that I believe that the body is so resilient, and it does. Sure. But when you're looking at going, here she is healthy, I feel like, too, the misconception is that the body can mask itself, and you don't always know because you're not showing symptoms or signs, which I didn't have any. and you're masking it. It's making up for whatever else that's going on internally, and it's doing its best to recover from whatever you're doing.
Yep.
And you don't know, right? Because it is such a machine. And what I've learned is that, you can give it chemo and you can pump. I mean, you can. And then all of a sudden, like 3 days later, it's like you watered a daisy. And then I'm like, whoop, back up and back at the gym doing my thing. It's the craziest thing ever. But now I get to the point where I'm like, okay, well, I could go, okay, well, I'm healthy now, right? I'm cancer free, and then not do anything. Or I could enlist more people as part of my medical team, which I've done, because what I personally wanted to do is pull back the layers and go, why did I get cancer? And there are, now I know a lot of reasons why I got cancer. And what I started being, as we talk about awareness, is looking at things and going, is this a plus or a negative, right? So if I am going back and looking at some of the mistakes that I personally made and using artificial birth control for many years,
right.
Huge negative.
Yep.
And then understanding how my body is not processing estrogen correctly because of all of these things, huge negative. Right. Our phones, not that this was a cause, but it certainly was a negative. I would run with my cell phone right here, and negative. So once we become aware and we start looking at things around us, like, environment, and I put my phone on airplane mode and it's not even anywhere near my bedroom anymore, and I'm just way more observant of what are the things that I am personally consuming, what is my environment, how am I eating, how am I taking care of my body, how is my body processing.
3 T's.
And that is the biggest thing, is like, how do I know what my body is how it's working internally? Right. You don't know until you have the test done. And so that's where I began a proactive approach to finding a healthcare professional to be able to do the proper tests so that I fully knew what are the things that are causing inflammation in my body. I don't know that that's happening. Is it the things that I'm eating? And, we over supplement, I think, a lot of times.
Heck yeah.
And again, the body has a unique way of fixing itself. There are certainly things where it needs help. There's no doubt about it. But it's like, how do I know that I'm really getting the proper supplement for me, for Angela? Yep. And it's individual. And I think that's the biggest thing too, is that we can watch or we can listen to a podcast and we can hear somebody who, has this regimen, and oh my gosh, if you're going to take 1 vitamin per day, let it be krill oil or whatever it is, right? And what happens is if my body isn't processing fats correctly, which it wasn't, I found that out, then it doesn't matter.
How did we know that? No, we didn't run the test. She had some very similar testing done that we do, because we're just kind of getting started with Angela on the little more testing. But that's where a stool test was so effective, is you were able to find out you weren't breaking down your fat, and that tells a lot about the gallbladder, how our body's going to be dealing with, just hormones and cholesterol in general. And so that information is so vital, because then we can begin to tailor something that's very specific to helping digestion, work on the liver, work on the gallbladder, because ultimately you need all those body parts.
Right.
The body will work better if we do that. And so, like, while we're on body parts, I was telling Angela, because I never told her before, because I was just kind of prepping for the show coming over tonight, and I was like, wow, 2015, that's when we first kind of reached out. I don't even remember. I think we just, a lot of different friends on Facebook, and we knew both were kind of in health stuff, and we were just, doing typical networking as small business people. And then we were friends on Facebook, and so years had passed, and it was just like stuff come up, and we couldn't make our connections that we were trying to, and it was just, life goes on. It's like all of a sudden I'm like going through my feed, and I'm doing Wellness Way stuff by then. And I was like, I started seeing stuff pop up on you. I was like, damn it, she's got breast cancer. I'm like, I don't even know this lady. And like, I was sick to my stomach, because I'm just like, I'm doing everything I know to get my message out, to get the Wellness Way message out.
Are you tearing up? He's like tearing up.
But it just bothers me so bad. Like, I want to save them all. You know, I literally want to save them all. And all I could think was, I know what's probably going to come next, you know. And then I thought, I don't even know her. Like, that would maybe just be rude to reach out in the middle of nowhere, you know. And then, you know, I don't know how much time went by, but it was, then all of a sudden, we were kind of joking before, I was like, and then I saw your booby cake. And I was like,
I had a bad titty cake.
and I'm like, oh my gosh. She had a mastectomy, and then I got even sicker, and I was like, what can I do to get this message out, you know? And so
Yeah.
time went on, you know, so maybe just share with you, you know, the audience here a little bit about just what we were talking about before, because obviously I'm never going to experience that. I'm not saying a guy can't get breast cancer, because you guys know that you can. Trust me, we can spend a whole nother topic on how that can happen, but you know, I think it'll speak to a lot of the ladies of just the disconnection that you had, kind of what you went through. I just think it's important for them to see that, because we're trying to get people to not have to go that route.
Sure. Yeah. You know, I think breast cancer sort of gets a highlight more than all of the other cancers. And and a lot of it is really due to the fact that there's all of these physical signs that come along with a breast cancer diagnosis, and it's chances are losing your hair. And then as a woman, as much as we want to say we're not defined by our hair, wait until you don't have any, right? And then wait until, you know, the chemo, you're losing your eyebrows and your eyelashes, and then you look into the mirror and you're like, who is this person? And that was a really hard thing to have to go through. Not that in a lot of ways that, again, we were not faced with these really hard lessons in life. And then all of a sudden, you know, you really start to go, well, what really defines me? You know, I'm the same person with hair, without hair, it doesn't matter. And then, you know, like, so going through that, and I made the best of it. Obviously I have dark hair, but when
what did you want to bring tonight?
My pink wig that I loved.
So if you guys saw the advertisement before we actually did the show, same gal, pink hair.
Yeah, I loved my pink wig, and I wore it on every one of my chemo days when I went in, because I thought, why the hell not? You know, like, why not just do me? And so I did cancer my own way, no doubt about it. And it wasn't just the pink wig as I went through my own journey. I did a video series. It's called 365 Days of Cancer, for any of you that want to go and plug in and watch the video journal of me going through. And I pretty much did a video every single day about the things that I was facing, because there's so many things that are coming at you. And I didn't know what a Neulasta patch looks like, you know, until it's on your arm, you know, and it's beeping, and then you know, like, so people ask, well, what is that? Well, just do a video, right? How do you read a T-score? You know, and all of these things that were new to me. I'd never experienced any of them before. And I thought, well, can't somebody just do a really quick video and show me in 2 seconds, or 2 minutes, what this is? And so that's basically what I did, is I walked people through my own cancer journey, through, you know, helpful tips that I found throughout. And there was a lot of things that I did that, you know, I think were maybe not scientifically proven, but I did it anyway. And so for me, how I made those choices as I was going through, is I really had to dial in and go, you know what, if it's neuropathy, I know what chemo does. And so I just went out and did a lot of research and understood that the science behind chemotherapy and why you lose the feeling in your fingers and toes is when you're getting dosed your chemo at the highest time that it is circulating through your body. There's vasoconstriction by putting your hands and feet in ice. And what that does then is it prohibits the chemo from going into those areas.
Oh, wow.
So there are a lot of medical professionals and oncology teams and nursing that I totally understand. And there's not enough studies out there that can prove that that's going to avoid neuropathy. Right. And so, you know, and is it because Angela didn't have neuropathy because she iced, or is it because she worked out and had better blood circulation in general, and then she ate, you know, and did this, and, you know, so again, you know, like, we don't know these things, but oh my goodness, like, it's ice. Like, I was sitting in the chemo chair anyway, like, what did I have to lose but the loss of my fingers and toes?
Yeah.
So for me, I made the choice to put my fingers and toes in ice during all of my Taxol and Taxine treatments. So it's not every chemotherapy that works with. There's certain, that they've done studies on. So again, I did a whole video series and created links in each of the video to the study so people could make up their own decision in mind on what's best for them. And always, of course, consulting, their medical oncologist or their medical team. But I did things like that. And then I did a lot of acupuncture. Pretty much every 2, maybe 3 days before I went in for my treatment for nausea. I was treated for nausea. I was treated for back pain. I was treated for bone aches, just internally, my chi was off every time I went in. So I picked a board certified Chinese herbalist who did acupuncture, and we did as much moving through energy of the body as possible. So yes, I did a lot of things that were not maybe traditional. I think the hardest thing for me is that I didn't ever really fit into either group, and I think that was the hardest thing for me. Is I felt like, for me, I was the one who was the hub of my medical team, which every patient should be, right? But the medical community was kind of like, oh gosh, here she comes, and she's gonna ice and she's gonna do all these things, and oh my gosh, and she's gonna ask us 5 million questions at the pharmacy. And literally, they saw me coming and they were like, please no.
Asking questions, we talk about this a lot. Asking questions can have a huge impact on the road you're going to take and the direction that you're going to go. I think you hit on a lot of, from a Wellness Way perspective, as we talk about the carpenter and the fire department. People think that that's, the only choice when it comes to cancer is that chemo, radiation, cutting something out, wherever it's at. And I think, now that you went through that, you're discovering there's a lot of different roads, and there's a lot of things that you can throw at it. That was, when I went through this, it was like, sure, you can do acupuncture, you can do massage. Obviously we're big proponents of chiropractic and working on your nerve system and spine, but then diving in deeper to, hey, let's test your immune system, because your immune system has the ability to be chemo, if you will. It's going to have natural killer cells. We need all of our, lymphocytes and B cells to be on top of their A game, because all that chemo now makes you very susceptible to secondary infections, because they've literally annihilated by design what your body should already do. So that's kind of the massive extreme fire department. Some people, they've got it so far, something has to be done right now. We get that. But okay, what happens after that for rebuilding, which is kind of now launched you into some things that you do. Can I say where you kind of work, or?
Yeah, absolutely.
Okay, maybe just touch on what you're doing there.
So I had definitely a leg up, for sure, because I had been working with and for Missouri Cancer Associates. So when I first found the lump in my breast, then coming in, I just simply said to one of the medical oncologists that happened to be walking down the hallway the same time I was, hey, I kind of got this little lump. And he's like, check your ass in the front desk and exam room now. I was like, geez, these people are serious about their little lumps around here. And I could tell on his face with the first physical exam that he was obviously has seen enough cases before. He knew what it was. He knew what he was dealing with. And then was in for a biopsy, and they sped things through very quickly, which they do with any kind of diagnosis, which I totally understand. You want to know, and the patient wants to know. You don't want to be out lingering for a long period of time, going, oh, is it cancer or not? Literally the next day I knew. So they definitely, with Boone Hospital Center, put me in, out, and I appreciated that very much. And I also appreciated the fact that I didn't feel like, yes, while I had one medical oncologist that was the hub of I had an entire team. I had, at my disposal, I could call somebody, as an RN and say, hey, can you look over this clinical study? What do you think about that? And I also had a network of breast cancer patients who had been through cancer before that put together, told me about the icing, like, here's how you do it, Angela, so I had a head start. So, like coming into that, being ready, I felt like was a huge advantage, just being in it and understanding, the physicians and the flow and knowing all of those things. I definitely had a head start in, getting through cancer for sure. So I was always very appreciative of having that as a resource coming in.
Yeah, that's excellent. So obviously I think a lot of people are going to ask, maybe, if you could do it all over again, what would you do different, or what could you tell, maybe somebody who's never been tested, who, we've got the extremes we talked about. We got the workout women and men that, are trying to eat organic, they're trying to do all the right things. Then we got the ones that just like, whatever, I'm going to keep drinking my beer and wine. I'm going to keep eating whatever I want. And then they wait till the diagnosis. I think we both have been around this kind of atmosphere enough to know, like, you just kind of rack your brain and go, how do we wake them up? For you, it was an abrupt halt because you got, the C word, diagnosis. Right now, we have an abrupt stop to our lives with COVID. And we were talking about just, time of reflection. People are going to start prioritizing what's important. In this time, to me, your health matters the most. You're with your families, you're with your kids more than ever right now, and people are going a little stir crazy. But, from a Wellness Way perspective, I don't want people to feel like you just, we're not going to throw the kitchen sink at you. I mean, we're definitely not, going to be here, take all these supplements. Like, that is the last thing that we want to do. We want to make it very specific to a person's physiology. Because honestly, like, no one's ever going to take your story away. Like, you grew massively through that. You learned a ton through that. But now you also, are taking your experience and trying to turn it into wisdom, because I would venture to say most women, for sure, and men, would not really like to go through that. Am I right? I don't think anybody
would agree.
like to go through chemo. So I just, speak to how they can do something different.
I think the biggest thing is having the lab test done regardless of whether you feel like you're great, because what happens is when I went in and had my test done, she said to me, Angela, you're going to have so much energy. You're going to feel so much better. And I was like, are you kidding me? Like, I'm already lit up and excited all the time anyway.
You haven't figured that out yet. You guys. Full of energy.
Right. But you don't know, right?
Yeah.
Like, there is no, like, I didn't know what my energy potential was until I got to the other side and got everything functioning the way that it should be. Mm-hmm. Now I've gotten from working out for 1 hour a day to almost 3. Like, seriously, if I'm not moving for 3 hours a day, and again, everybody is completely different. Yeah. But how many things do we not know that we're really not functioning at our top? We think we are, but we have no idea what top is anymore, because we've gotten so lack of sleep, right? We've gotten inflammation and we've gotten all of these things that we have no idea what good is. Right. And so for me, I would definitely have all of the testing done just on a proactive basis to know exactly what is going on the inside, right? We take our cars in for tune-ups, for crying out loud, right? Exactly. And we don't even go to our own body to do that until sometimes, unfortunately, it's too late, or you have to go through something massive like breast cancer like I did.
And that can happen with wrong testing.
Right.
I mean, I see tons of females on hormone replacement therapy, still have a uterus, still have ovaries. I'm like, you can still make it, ladies. Like, how do you know you're not being pushed into, a cancer, environment? I'm like, have you ever had a Dutch test? I mean, that's like my first question. And then it's like, Dutch what? Netherlands? I'm like, no. I mean, it's dried urine test and comprehensive hormone. Did your doctor ever do that? It's like, no. So, because just looking at the blood just tells me about production. But when you look at a Dutch, now we're watching the metabolites, how your liver's, breaking things down, how it's getting rid of that stuff. We get to look at your adrenal glands, so much of that cortisol response has a ton to do with your immune response, blood sugar. I I mean, there's just so many things that if we just continue to take the approach of categorizing every system instead of taking the Swiss watch approach and saying, hey, if we mess with this dial, it's going to definitely influence everything else. And so, like you said, we got to go to the testing, and it doesn't necessarily have to be, hey, here's $1,000 worth of information I need. Go
Right.
get it done. It may just be take the first step. Go get a Wellness Way immune panel and let's look at your CD4, CD8. Are you making natural killer cells? Are you making those little Pac-Mans to come fight off infection, or get a food allergy test or stuff? I mean, wherever it is, like, we just want somebody to take action and not get paralyzed with all the information, right? Because there's a ton.
It is, and it is a lot of information, but I think too is everybody has to know what their why is behind doing it, right?
Mm-hmm.
So I think, what is the intent behind it? What is the motivation behind it? And so we all have different motivations, whether it's being here for your kids and your grandkids, or being, better and more productive at, work, or, more creative, or all of these things. You have to know what your why is, because if your why isn't strong enough, then you're not going to show up at the, your office to go and have the testing done. You're not going to put the effort and make it a priority. So I think that's the biggest thing, is really understanding, what your why is, what is the lifestyle that you want to have, what is the type of life that you want to live. And, I think those things are really important to really hone in and know those things.
Oh, yeah. 100% agree. Yeah, so there's a lot involved there with Jean, right?
I was listening. I was trying to read what she was saying. I got her little purple heart, or little green hearts earlier.
Nice.
So.
Yep. Yeah, Jean's a regular. Amber's a regular. We got lots of people all over.
Nice.
So, and even more so as we share these lovely videos going forward. So, trying to think if there's anything else. If you guys have any questions, go ahead and throw some questions out there. Anything else you want to leave them with, as far as, like I said, we're just kind of getting started with Angela from a Wellness Way perspective. I just so appreciate your proactivity. I mean, it's not like she hasn't been trying to get more information. What's she right?
She's saying one for each of you.
Oh, Purple Heart. Nice.
Oh, she's so sweet.
Yeah. So, you're just trying to really complete kind of the picture for yourself, or put all these puzzle pieces together, because I think there was some new insight, from a testing perspective, that you're like, I think I'm missing a component there. And, through all of your treatment, this is what I was kind of blown away by, is not once was like a CD4 or a CD8 count ever looked at, or a CEA test to see is there any kind of abnormal extracellular growth taking place. And so there's just, again, our way of thinking is going to be a lot different. It's not that we're trying to see how we can naturally cure disease.
Right.
It's it's as simple as this. I think if we start with the premise of the body was genetically designed to express normal and health, like that. If anyone is to ever say it's all in your genetics, I will say yes, and those genetics express normal, not disease. And that's the way people have been trained to think, that, oh, my genes are bad. I'm like, that's been like out the door for a long time now. And we know about epigenetics, and that lifestyle can turn those genes on and off. And so what can we do now to just shift it to where, hey, you take those stressors, the traumas, the toxins, the thoughts out of our body, genetically, our bodies know how to express that normal function. So there you have it, guys. World's problem solved in 35 minutes. So, but I'm just glad you came on. I look forward to just kind of developing our relationship more. I think she's got a very unique opportunity where you're at with, it's Missouri Cancer Associates, correct?
Yeah. Mm-hmm.
And just, she spends a lot of time with patients they're coming out on the other side.
Yeah.
Because I
and
mean, I
then you
can't
have to
even imagine
rebuild,
what it's like. So.
and it's really difficult to put your life back together after something like breast cancer.
Mm-hmm.
It's a complete reset, and there's there's all of these things that go along with it, and it's difficult to rebuild. But I feel like if there's it's just one step at a time,
Yep.
and meeting people where they're at and giving them information and knowing that they're not alone, because you can have support, you know, of your medical team, and you can have support of your husband or, you know, your family members. But I wrote something the other day. I was like, but nobody's going to take the chemo for you, right? Nobody is going to, they're not going to do these things for you. You have to do it for yourself, and you have to want it for yourself. And, you know, somebody else who has been through that exact same thing, those are the people that I just truly found the most support from. My cancer, you know, breast cancer, there's different support groups and Facebook groups that we have here in town. And it's just so helpful because you can say something and somebody knows exactly what you mean,
Yep.
you know, and
Community is
it
huge.
is huge. It is
You
huge.
use the word rebuild, and I love that word, because that's kind of, you know, just what we say a lot in the Wellness Way. It's about rebuilding. It's about restoration. You know, it's never about boosting. It's never about, you know, preventing. Like, I can't do any of that stuff. We just have to be that investigative doctor that shows you how to remove stressors so you can rebuild, so you can restore. And I love that terminology. And the community. So, you know, I saw April.
The testing.
So April is fairly new. I love, you know, we talked about community today. We did a live with her today. Today is live day. We got lots of positivity. We had to get over the
awesome.
negativity, but
That's good.
we talked about community, and that's like Wellness Way. It's an us, we, our culture, and so we've got ways to, you know, get involved. You can do women's wellness, or is that right? Wellness Way women's group. We've got the Wellness Way challenge group.
Nice. Mm-hmm.
So the challenge group is for anybody, whether you're a patient or not. There's like 5,000 individuals across the United States that are involved with the Wellness Way. I mean, we did No Sugar January. We did.
Oh, that's cool.
February was.
That's
like
a hard one, by the
No
way, for
Stress
anybody who did
February,
no
I
sugar. I
believe.
did it recently.
Yeah.
Holy smokes.
March was
Whew.
fitness. Yeah, Dr. Nathan Thompson did a phenomenal job in just leading us in just, you know, some fitness stuff for the lay people to do on a regular basis, just move. And April is kindness month. So I'm super excited about that. Just, you know, so we're going to be doing tons of giveaways this month. We're going to be giving away tests. We're going to be giving away some supplements. So I'm telling you guys, you'll want to stay watching, and you're going to have to start sharing the videos and engaging more, because that's how you're going to get your name in the bucket to increase your chances for winning. I think we're going to give away that Wellness Way immune panel. I mean, it'll be, you know, by the time it's all said and done, probably close to $1,000 more giveaway in this time. So
Nice.
we just want to try to make it possible for somebody to start doing something. And even though it's stressful, I feel the same pain. I'm running my own business. I want to keep all my employees, you know, and you guys are a big part of that. So I appreciate your support and staying connected with us. And then maybe when we're done and you go and get on here, if you can just maybe hook up some links if people want to just know more about your story and watch
happy to do that.
365. I think that'd be great to, you know, get in there and see. I mean, take some time to learn what Angela went through. Like I said, we're never going to take Angela's story away from her. Yeah, we were probably
There's a lot.
as raw as Angela is on her videos. But that's all right. That's Angela, you know. But I really appreciate you guys hopping on. Please like and share the video. Again, we depend on you guys. We need you guys to continue to grow the culture and engage people into just thinking differently about health, because where has the traditional way of thinking gotten us today? Hundreds of thousands of people are dying taking drugs all the time, and I won't belabor that. I've beat that dead horse all week on drugs and things that are immunocompromising people. So that's all I'm going to share tonight. Anything else you want to leave them with?
No, not. I think one you said April was national or kindness
Wellness
month.
Way's kindness
I
month.
know, I like that. And on the way here, I saw somebody simply do one little simple thing. They took a joy sign on a little stick and put. Did you see
Was
that?
that over by
Yes.
Gerbs on by the Arc?
So
Yep.
spread a little joy today.
Yeah, definitely.
It was great.
I love it. So we
Yep.
need that. Okay, get off
We
the news.
do.
Hang
Yeah.
out with us. We're fun to be with, and we have lots of positivity. So thank you again for being on. And
Yeah,
I know
thanks.
this will greatly impact a lot of people.
Hope so.
Oh yeah. All right, we'll see you guys later.